Hello, everyone, and greetings from South Africa. I have met many families and many of you, but for those who I don't know, I'm Prof Petrus de Vries from the University of Cape Town in South Africa. And for many, many years, I lived in England and have been very much part of the TSC community over many, many years. I'm so sorry I can't be with you in person to have this session, and it's very hard to spend 10 minutes talking about a complicated topic such as research into new and available therapies for TAND, but I thought I'd at least make a small start to summarize for you the keynote that I gave, and at least to have a brief starting point for a conversation with all of you. Many of you will be familiar with and will have heard of the Tandem Project, which in part is co-funded by the TSA UK. And this is a nice picture of the team from 10 different countries in the world, multidisciplinary. And during this project, we're actually trying to develop a new TAND checklist that families can complete themselves, that we're then building into an app that can then, once you've completed it, give you a basic toolkit of things you can do to improve the TAND outcome for yourself or for your family members. As I was preparing the talk on TAND interventions and what's already been done, this lady in the front, Professor Anna Janssen from Brussels, I was having a conversation with her and I said to her, do you know what? I don't know what I'm going to talk about because there are so few things that have actually been done in interventions for TAND. For many decades, we've all been spending our time describing the problems, but we don't need to tell mums and dads and families who live with TSC what the problems are. We need to think with you about what the possible solutions are and what we can do about it. And Anne said to me, why don't you think about some of the intervention research you've been doing in Africa? Because some of you may not know that actually I have a research team in Cape Town called the Center for Autism Research in Africa. And one of the things that we do a lot of research on is actually intervention for autism and related disabilities. And so here's an introduction to my autism research team in South Africa. But what I'm going to do there, or what I did in the keynote, and what I'm briefly going to do with you today is just to remind you of TAND and briefly tell you what the evidence is for currently available therapies. Then we'll talk a bit more about therapies, and I'll say how we then try to think about what we learn and do in Africa and how that might be relevant to TAND and TAND intervention all over the world. Just a reminder, we coined this term TAND in 2012, and we use it as an umbrella for all the different neuropsychiatric things. The behavioral difficulties we may see, the psychiatric disorders that might be diagnosed by specialists, the intellectual profile of strengths and weaknesses, the academic challenges people with TSC might have, the neuropsychological, so these specific brain difficulties, brain skill difficulties that people might have, and the impact, the psychosocial impact on self-esteem, self-efficacy, family stress, relationships, and so on, that you will all know very well, and that's important for us to remind people of. Because all these things are so complicated, we took 3 of these levels, behaviors, academic, and neuropsychological, and we tried to find what we call natural clusters, things that typically occur in real life. And we found that we could get 7 natural clusters of TAND difficulties. So when I now think about new and available therapies, I think both about the TAND levels that I've just shown you and about the different natural clusters of challenges. Well, let's talk about available therapies then. As part of the Tandem Project, Stacey Bissell, Stephanie van Klooster, and the consortium did what we call a scoping review. So we tried to get like a bird's eye view of all TAND research that had ever been done and published in journals, and then to get a sense of where the gaps are. One of the questions that we asked was about intervention research. And of all the studies, we identified 230 that had something to do with TAND, some animal case report cohort studies, of all these studies of groups of people with TSC. only 15 of them were interventional studies about treatment of TAND. And none of them were about non-pharmacological treatments. And I'll talk more about that in a second. So in the drug treatments that had been used for TAND, some were about existing medications for existing TAND, things like melatonin for sleep. Some were existing medications, but for new TAND reasons. For instance, bumetanide, one study, which is it's a diuretic drug. Can it help autism in TSC, for instance? And a number of studies have also been using mTOR inhibitors and other novel compounds or drugs for autism or learning or other kinds of TAND manifestations. But the one that I was most interested in is what we call non-pharmacological interventions. So these are either talking treatments, psychological treatments that you might hear of them, or other non-pharmacological treatments like assistive devices or things like that. And you get so many different kinds of non-pharmacological treatments for individuals, for caregivers, in groups, by specialists, delivered by caregivers, different models. It can be short or long, very intense or not. And that's why it was so striking that of all research ever, we found 0 non-pharmacological studies in tuberous sclerosis and in TAND. To be fair, there was one study, but it fell outside the scope or outside the time of our study. So in the USA, Dr. Shefali Jesti and Connie Kassery, they used a program called JASPER. JASPER is an autism early intervention program, and it stands for Joint Attention, Symbolic Play, Engagement and Regulation. And they are currently doing a study to see if 12 to 36-month-olds, little young children with TSC, in this intervention delivered by their caregivers, usually mum, can improve their communication skills. But at the moment, it's the only non-pharmacological study in TSC anywhere in the world that we've been able to pick up in this way. And so that means that most people with TSC have TAND difficulties, but we have almost no evidence for interventions. And it's hard for people to get access to experts on TAND. And as you will know, we might need a psychologist or a psychiatrist or a speech therapist or an educator. So that makes it really hard. And as a result, many people with TSC and TAND never get interventions. And we have to think what we can do to improve that situation. And so I tried to look, and we tried to think with our work in Africa, in autism, because there are many similarities. Most children with autism live in poor countries of the world, where people know very little, where there's little access to intervention. And so most children never get diagnosed or treated for autism. But we have tried to identify a number of different strategies, slightly new strategies, unusual strategies to help reduce that problem. So for instance, and these are the 5 points that I had made, we're really focusing on what the needs are of families. And we're trying to understand the systems that people work in, the education, the health, the other systems, to see if we can strengthen those systems. We realize we can't wait for people to have a diagnosis. So we're trying to do interventions and support right from a young age, as soon as mum or dad or anyone is concerned. We try to build a pyramid of interventions, so from very basic things to more complicated and more complicated up to specialist ones. And we try to do it in a way that the most specialist people actually support, coach, supervise. We call it task sharing with other people at lower levels, so that the few experts we have can really increase their footprint to reach people. We realize that we need to ask not just, is there a randomized controlled trial for this particular intervention, but is it acceptable to people? Is it accessible? Is it affordable? Is it feasible to families and people who live with these conditions? And we realize that we need to think of novel ways, innovations. How can we use technology or find different or new ways to reach people, to teach people, and to do intervention? And so the Tandem Project is one example where we're really trying to think with families, how do we empower them, because we know the systems aren't ready, and how can we give them tools? That's a first step tool. And I think apart from all the kind of positive things that we're doing, I think there are still many, many gaps that as a TSC community, we need to think about how do we improve this in the coming years. And the first one in this system of mine, we still know very little about the health and the other systems that you all live in all over the world. And I think we need to do that in order to know how can we strengthen that? How can we bring services together? How can we integrate TAND into clinical care so that you can get access to interventions for TAND? I think, as in the autism community, we shouldn't wait in the TSC community for people to get a diagnosis. A child with TSC might not be diagnosed with autism until they are 7, but from very early on, they might have social communication needs. So I think something about parent education and training on TAND, giving parents skills to work with their children with developmental challenges, to empower them. And this one is, I think, the most important of them all, to support the well-being of caregivers. You all have an incredible burden caring for a family member with TSC, and we need to find ways. And in fact, there are strategies, short, simple strategies to strengthen and improve this. We need to build that pyramid of intervention from basic things you can do to things can be done in the community to all the way up to specialist things. And I think caregiver mediated intervention, in other words, the kinds of interventions that you can be the facilitator of at home in your daily routines as part of daily activities, probably have the greatest chance of being useful. We need to make sure that as we go into the coming years, that we do research that's not just all about randomized controlled trials in interventions, but that also looks at these concepts that I've just mentioned: feasibility, appropriateness, affordability, accessibility, cultural appropriateness, and so on. And of course, we need to innovate. And I think there's huge potential to use technology for screening, for diagnosis, for intervention, for training, and so on. But we need to be careful. Not everyone has very good access to technology. Particularly in poorer countries, it's either slow, or difficult, or expensive. But altogether, not much today available for TAND interventions, but it means that there's huge scope for us to think, how can we build programs of research for pharmacological, for non-pharmacological interventions across all those levels of TAND and the clusters, across different levels of expertise, using technology wherever we can and wherever appropriate, in order to think, how can we really strengthen access to interventions for everybody with TSC and TAND. And with that, I hope that this is a whistle-stop tour of the more detailed presentation I gave across these two teams of my research. And I thank you, and I hope we'll have a chance for a lovely conversation now. I just so wish I could have joined you for a real cup of tea, but hopefully one day we can do that. Thank you very much.